Welcome to the MamasteFit YouTube channel. In this workout video, we're going to be doing a birth prep circuit to help release common areas of tension that you may be having during your pregnancy. If you want the full birth prep circuit in an ebook, you can grab it down in the show notes below. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and I have combined my experience of working with in-person prenatal clients, online prenatal clients, and then also supporting in-person birth to create online prenatal fitness programs to support you throughout your pregnancy to not only keep you strong, but also to prepare you for birth. And in this birth prep circuit, we're going to be focusing on releasing tension in the uterus to help your baby's position, and then also releasing common areas of tension so that we can create more space in the pelvis as we navigate our pregnancy and prepare for birth. The first movement is a forward-leaning inversion, and you're going to use an elevated surface like your couch, or if you have a workout bench, you can use a workout bench as well. You're going to start in a hip extended position and then come down to your forearms, so you're in a fairly upright position. And so the legs should be fairly relaxed. We're on less than a 45-degree angle, and you're going to feel a big stretch here in the lower sacral area or like the lower back. You may even feel a stretch in the round ligaments on the front side of the uterus as well. And so what this movement is doing is it's helping to release tension in these lower uterine ligaments and then also in the round ligaments. So all of the vertical running ligaments is kind of stretching them to release, and so it should feel pretty good. Stay here for about 30 seconds or about like 3 to 5 breaths. And then when you feel ready, you're going to extend in the arms and then walk back to your bench or couch and then finish in an extended hip position and just take a few breaths from here, and then we'll move on to the next movement. During pregnancy, we tend to favor a posture where we're very arched in the back with the toes slightly pointing out with more external rotation. This is obviously very exaggerated, but because of this common postural tendency, the lat musculature or the back muscles tend to get very shortened, and the hip flexors on the front side of the thighs tend to get shortened. And because of this, it's decreasing space in the pelvis, particularly the bottom half of the pelvis. And so the first movement that we can do is a back expansion breathing exercise. And so you can either hold onto like a door frame or a sturdy structure, or you can hold onto your partner's hands. You're going to be about arm's length, and you're going to sit back like you're trying to sit in a chair. So we have this very rounded position, and the legs are like a 90-degree angle. You're going to inhale into your back to feel more expansion, and then exhale, think pull rib cage, pelvis closer together as you round a little bit more. So with every exhale, you should feel like you're stretching more in your low back. And then every inhale, you should feel like your back is expanding even more. You could even think inhale to the back half of your pelvic floor and then exhale to lift the front half. So we'll stay here for about 5 more breaths. So big inhale and then exhale to lift in the front. Another big inhale, feel your back expand. Another inhale to expand. Exhale to round a little bit more. Big inhale. Exhale to round. And last one. Big inhale. And then exhale, let go. Once you're done, you'll come back to your standing position. And you should feel like your back is like a lot more stretched here. And now we'll move into our second lat release exercise. The second lat release exercise is going to be the forward-leaning lat release. So you'll start by facing a wall, pressing your hands into the wall, and then you'll step the feet back so you come into this 90-degree angle with your body. From there, you're going to step the feet perpendicularly so they're pointing in the toward the side of wherever you're pressing. And then the lengthened side hand, you're going to press harder into the wall, and you're going to feel more of a stretch through the side body. Try to think rotate your chest towards the floor, and then think push your chest and belly away from the floor to find a little bit more rounding. A way that your partner can help you with this movement is they can kind of lock your hip in with their hip, and then they're going to kind of push and pull to help you find a little bit more length. So sometimes even coming to like the opposite side and then pushing and pulling to help them find a little bit more length can also be beneficial. So we're trying to exaggerate this length through that side body. We'll stay here for about 5 more breaths. So big inhale into these side ribs. And then exhale, think try to push your belly away from the floor as you pull rib cage, pelvis closer together. Big inhale, breathe into these side ribs. Exhale, press harder through this hand. Another big inhale, feel these ribs expand almost as if they're pushing apart from one another. Exhale to bring belly away from the floor. And then last one, big inhale, and then release. Now let's do it on the opposite side. So you're going to do the same setup where you're going to push your hands into the wall. You're going to step back, step the feet perpendicularly in the opposite direction. And then again, the hand that's on the lengthened side is going to be the side that's stretching more, and you're pressing harder into that hand. So finding a big stretch through the side body. Then keep the chest towards the floor. So you may have to rotate the shoulders down. Big stretch through this side body, and then exhale, lift the belly as you kind of push the chest away from the floor. Big inhale to feel expansion in these ribs. Exhale, press harder through this hand. We'll do about 5 more breaths here. Big inhale into this side body. Exhale, round in the back just a little bit more. It's going to help bring you deeper. Another big inhale, feel the ribs expand. Exhale, press harder into the hand, about 2 more breaths. Big inhale, exhale to release. And last one, big inhale, exhale, let go. The next movement that we're going to be focusing on is releasing the hip flexors. So the lats usually are pretty tight and they're kind of pulling us into more of this arched position. And then the hip flexors is going to be kind of tight, pulling the pelvis more forward. This is pulling the pelvis into a more anterior position, which is helpful to make it easier for us to find external rotation. And it can also change the angle of the pubic bone to sometimes make it easier for your baby to enter. However, if we cannot get out of this anterior tilt and come to a more rounded position, it's going to be really hard for us to create space front to back in the top of the pelvis, and then also to create space in the bottom of the pelvis, because a posterior pelvic tilt is easier to help us find internal rotation, which is really important for the lower half of the pelvis. So with this half kneeling hip flexor stretch, you're going to tuck your butt underneath and then push the hips forward, and you're going to feel a really big stretch in that front thigh. From there, the same side hand of the down knee is going to reach overhead and then reach towards the opposite side. A way that you can support this as a partner is I like to put my knee against the up leg, and then I could just kind of pull towards the opposite side. So I'm supporting her with my body, and then I'm pulling on her arm to find more expansion in this side body. So we'll do about 5 more breaths here. So big inhale into the side. Exhale, tuck your butt underneath just a little bit more. Big inhale into the side body. Exhale, tuck the butt underneath. Big inhale. Exhale to tuck. And it's just really, really little movements. Exhale to tuck underneath. Last one, big inhale. And then release to switch to the opposite side. So now you're just going to bring the other leg forward. You may find that one side feels a little bit tighter for you than the other, and that's perfectly normal. We're asymmetrical. So you're going to tuck that butt underneath, push the hips forward, and then you're going to reach overhead so that we're finding this side body stretch. Now, if you don't have a partner to help you with this workout, you can just do this by yourself. Or if you have like a door frame, you can grab onto the door frame with your hand. If your partner is with you, they can help support and add some traction to it as well, which just helps you move a little bit deeper into it. So big inhale into the rib cage. Exhale, tuck your butt underneath just a little bit more. Feel a little bit deeper of a hip flexor stretch. Another big inhale. Exhale to tuck. About 2 more breaths here. Big inhale. Exhale to tuck. Last one. Big inhale. Exhale to release and to let go. After we focused on helping with the pelvic position from front to back, we also want to be focusing on creating more internal rotation at the hip and in the pelvis. And so during pregnancy, we tend to favor that extra rotation with the toes pointed outwards, but it can be harder for us to find the internal rotation that's really important to opening the lower half of the pelvis. This is where your baby's finishing their rotation to get underneath the pubic bone. And it's also a place where we see late labor stalls. And so if your baby appears to be too big for your pelvis, or your pelvis appears to be too small, it could be related to the inability to create space in the bottom of the pelvis. And so emphasizing internal rotation with your prenatal workouts and with your birth preparation can be very beneficial. And so ways that we can do that is with hip shifted movements. And so grab a yoga block or like a small stack of books. You're going to place the yoga block underneath one knee, and then we're going to shift our weight over to that elevated knee. And so one hip should be higher than the other. If you lift the lower leg, your body position should not change. If you were not shifted over and you try to lift that leg, you would have to shift your weight to accommodate for that. So this is a really good way to figure out whether or not you have shifted over or not. So we're going to shift our weight over. You should feel more of a stretch in this posterior hip pocket as well. And we're going to move through some pelvic tilts. So you're going to round in your back. Try to pull rib cage and pelvis closer together. I like to exhale with the rounding, and then inhale to drop the belly to the floor to find more of an arch in your back. And focus on keeping that hip shift. Something that can be really helpful as well is you can either use a wall or your partner can stand right next to your lower leg. And as you shift over, you can press into like their ankle or the side of their foot to bring you deeper into that hip shift. So you can either do this without any sort of additional support or deepening of this exercise. So you can either use a wall or your partner can help support you. So I'm going to help support Roxanne in this movement. She's going to shift her weight over, and then she's going to move through about 10 pelvic tilts here. So you're going to round into your back and then draw off the belly to the floor. We're not trying to find our deepest expression of either one. We're just moving through what feels comfortable for us. So we're going to inhale to drop the belly and then exhale to round in the back. You can also do one full round of breath with the arch or one full round of breath with the round, depending on what feels better for you. So we can inhale to drop the belly down, exhale to round. And as you round, think you're trying to pull rib cage and pelvis closer together, which is going to bring you deeper into that posterior pelvic tilt and then also help you move deeper into internal rotation, which again is really important to creating more space for our baby in the bottom half of the pelvis. So do about one more movement here, and then we'll switch to the opposite side. So go ahead and take your elevated surface, such as your yoga block or your books, and you're going to put the opposite knee on it. And then same thing, shift your weight over so you feel more of a stretch in that glute. If you can lift the lower leg, you shouldn't change your position at all. If you're shifting around, we need to shift the weight over a little bit more. Your partner can either stand directly next to you so that you can push into them with your lower leg, or you can use a wall. Start to move through your pelvic tilt. So exhale to round, and then inhale to drop the belly down to the floor. Every movement, make sure that we're still shifting the weight over. Sometimes we'll start to kind of rock towards the lower leg as we get more fatigued or as we just stop kind of paying attention to how we're feeling. But you should almost feel like your pelvis is just like rotating on your femur with all of these pelvic tilts, which should feel like a really good hip mobility exercise as well. So we'll do about 3 more pelvic tilts here. So exhale to round, think pull rib cage, pelvis closer together. Inhale to drop the belly. Exhale, think pull baby to spine. And then inhale, drop belly to the floor. Last one. Exhale to round in the back, and then inhale to drop the belly down. The final movement in our birth prep circuit is going to be the standing hip shift. So this is going to be really similar to the all fours hip shift, where it's creating more space in the lower half of the pelvis with that internal rotation. And so you're going to start by either using no yoga block, or you can place one foot onto that yoga block. With the opposite hand of the elevated foot, you can either hold onto your partner's hand, or you can hold onto a door frame or a sturdy structure. Start by shifting your hips back so you feel a stretch in the hamstring. And then you're going to bend in the lower leg so that your pelvis rotates towards your straight leg. Then think weight in that big toe, and then almost like you're rotating the knee inwards to intensify the stretch in that back hip pocket. And then we're just going to breathe here. So think big inhale to breathe into your back. And then exhale, think lift up in the front half of your pelvic floor, pull rib cage, pelvis closer together. So think big inhale into the back half of your pelvic floor. Exhale to lift the front half of your pelvic floor. Inhale into the back. Exhale, think round to the back or push belly away from the floor. We'll do about 5 more breaths here. So big inhale into the back. Exhale, lift in the front. Inhale through the back. Exhale, lift through the front. For a lot of us, the back half of our pelvic floor tends to be a lot tighter. and the front half tends to have more length. So emphasizing our breath in this manner can help to release tension in the back half of our pelvic floor while also strengthening the front half of our pelvic floor. Do about one more breath here, and then let's switch sides. So come back up. If you need to catch your breath before you switch sides, feel free. You're going to put your opposite foot onto the elevated surface. You could also do this without holding or with your foot on anything as well. Hinge the hips back, and then you're going to bend in your support leg. This is going to help rotate that pelvis towards the belly. Shift your weight over to that elevated foot. Again, if you could, you can just lift that bottom foot and you would somewhat maintain your position. The standing is not quite as easy to do. Weight in that big toe, think rotating the knee inwards to help create a little bit more activation in that back hip pocket. And then breathe here. So big inhale into the back. Exhale, lift in the front. Think round in the back just a little bit more. Inhale to breathe through the back. Exhale to lift through the front half of the pelvic floor. We'll do about 3 more breaths here. Big inhale into the back. Exhale to lift in the front. Think try to pull rib cage, pelvis closer together. It's a really slight movement that's happening. It's not like huge movements with the rib cage. 1 more breath. Big inhale into the back. Exhale to let go. So that concludes our birth prep circuit. What we're doing with the birth prep circuit is releasing areas of tension in the uterus to help support your baby's position, and then also releasing common areas of tension during pregnancy to make it easier for you to open your pelvis when birth comes. If you want more movements to help support you throughout your pregnancy to not only keep you strong and pain-free, but also to prepare you to open your pelvis for birth, be sure to join our online prenatal fitness program. Our online prenatal fitness programs offer daily workouts that offer strength exercises, pelvic floor release exercises, pelvic stability and core exercises, and also tons of pelvic opening exercises as well. You can check out all of our prenatal fitness programs on our website at mamastefit.com/fitness-programs, and we'll link them down in the description below. If you want to check them out, be sure to use code YouTube10 to get 10% off all of our online programs. And if you bundle them with childbirth education, you save an additional 15% off. If you enjoy this video, be sure to like and subscribe to our channel so you get notified whenever we release new workout videos. We release 1 new workout video every week and 1 to 2 educational videos every week supporting you through your pregnancy, your birth, and beyond.